90th anniversary, we've been searching our archives to see how we've helped shape television history.
Yeah, it's nice to look back, and this time we're going to the 1990s and the Children of the 90s project, which to this day looks at people's lives to help understand society's big health issues such as cancer, obesity and heart disease, as well as mental health. Richard Payne has been speaking to some of the first to sign up for the study and the woman who started the whole thing.
I like this one. I just think it's a nice picture of us. It is. Because it's quite bonding, really.
A bond Michelle and daughter Lindsay share not only with each other, but the study, which has been with them since before Lindsay was born.
They ask you all sorts of things about your environment, your home, the sort of domestic products you use in your home, the food you eat, if you drink alcohol, if you smoke. Everything really that affects your daily life.
Michelle was the very first of more than 14,000 pregnant women in the wider Bristol area to sign up for Children of the 90s, which would go on to become the most in-depth analysis of health and well-being anywhere in the world.
Do you feel like a pioneer?
In some ways, yes. Yeah, and I think that's why it's kind of helped the momentum of continuing to be part of the study, knowing that we were the first, and it feels important to keep that going.
One of the early concerns of new parents surrounded sudden infant death syndrome, known as cot death. Children of the 90s research helped to save lives by showing it was safe for babies to sleep on their back.
As soon as they started to have some findings, we changed our ways and we put the babies to sleep on their back. We were much more mindful of the temperature in the room and what the baby was wearing to bed. So yes, it really did impact us.
I knew very early on that it was going to be twins, so I was quite keen to join in.
Elizabeth Troop was the first soon-to-be mother of twins to sign up. The premature birth of now 34-year-olds Alice and Charlotte further informed the study, and all three are still regular contributors to the questionnaires and clinics which continue to this day.
I think it's good we were involved because we've been able to ask all the questions over the years that have been relevant to both the girls and ourselves as parents, and questions that perhaps we wouldn't have ever considered. And the research that they've done has proved to find solutions to lots of things.
I think it's nice to just be involved. It's nice to be involved in
really
the
nice.
90s, and you know, we get sent newsletters often, which kind of shares up-to-date research and kind of what projects they're working on. You do feel like you're involved as well in terms of realising, you know, where your kind of information is going and what it's contributing to.
There were some things that I learned from being part of it, that's for sure.
Huge amounts of the early findings had to be kept in paper form and were waded through by project founder Professor Jean Golding of the University of Bristol. Now 85, her appetite for the work remains, still driven by the never-ending question of why different children are prone to different patterns of health.
I get quite emotional about it because so many people, parents in particular, have given so much to it. And that was partly because of the way in which the media were reporting it, including ITV or HTV at the time. And so we had a lot of support that way, as well as from other forms of the media.
Support not forthcoming from all quarters at first, not least because of its cost. The value now, however, indisputable.
Did you actually think it was possible?
Fortunately, no. Well, I didn't think I didn't have any concept of what I was taking on.
8,000 of the original parents are still involved in some way, with new generations now adding their experiences, all informing a body of work which continues to transform the world of scientific research. Richard Payne, ITV News, Bristol.
It's just breathtaking, isn't it?
Study.
On our doorstep as well.
Yeah.
And the work continues. Of course, the current principal investigator for children in the 90s is Nic Timpson.
Yes, and Nic joined us in the studio a little bit earlier and told us why he thinks the study is so special.
When you look at children in the 90s, really the most striking characteristic is its length of time. It's been running for such a long period. So we recruited women when they were pregnant, and the babies that were delivered then have been followed through their entire lives. And here we are 33 years later watching those babies have babies themselves. So it's really striking that we can follow that entire life course.
And people are still invited to be part of this, aren't they? And you're still finding more who were born between that period.
That's right. The great thing is that people can take part at any time. Although we're following a specific cohort of individuals through time, if you're part of that group, or indeed you're part of it and have children, or you've got a new partner or grandparents, then you can be part of the study at any time.
We saw from Richard's piece regarding cot death, the study that was done around that. But since then, things have changed technologically. I mean, technology that can help you, technology that has maybe hindered a lot of the people as well. How has it affected people?
Sure. So affecting people and how we use it are different things. So on one side, we're seeing that there may well be, I mean, crumbs, when our cohort started, there were not mobile phones, there wasn't social media, and we've seen the arrival of that material. And really important work has come out of that. We've seen, for example, how there is a relationship between self-harm and mental health in young people and content online. And we've been able to provide information that then feeds forward into policy to help guide those questions and problems. On the other side of things, we embrace technology, and we've got to get out there and use it. We like to make things as easy as possible so people can work remotely on the study. You know, you can take part and fill in your questionnaires online. We wear activity monitoring equipment for participants. So there's lots of ways to embrace it, as well as also incorporate it in our work.
And can you see the development of more use of technology as you go forward in terms of the study itself?
Oh, absolutely. It's unequivocal. We'll see more remote contributions. We'll be thinking about people's homes, people's environment. So it may well be personal and local, but it could also be the use of technology within our city and environment to think about external exposures, air pollution or temperature for that matter.
But what about the analysis of it with AI and so on? Because, of course, you've got a mountain of data to go through. For any human, that's a lot.
It is, and we are fully embracing the opportunities that are there technologically for analysis of data. In fact, we've been doing it for many years. Number crunching is part of the game, when we measure lots and lots of things on people, not just at any one point in time, but through time. All of a sudden there's a challenge to securely manage data and make it safe, but then also facilitate research and allow people to do exciting things.
Do you still love it?
Oh, absolutely. It's a gift job. So I come from a background of human genetics, but I'm doing all sorts of things, and I'm allowed to work with researchers doing social sciences or medical research and all sorts of different things. So it's a really compelling enterprise.
Okay. And I think people feel blessed that it's on our doorstep as well.
Absolutely.
So please stay in touch with us. We love following this. Thank you.
Anytime.
It was such a privilege talking to Nic as well, wasn't it?
It really did feel like a privilege. I mean, the amount of data they've got in there, and they have constant requests for it as well from around the world. Brilliant.
Amazing.